used to party out a lot. I'll party all the way from 10 p.m. all the way to 7 a.m. Then I'll come home, then I sleep. Yeah. Now I can't last until 12 a.m.
March 21st, one something. She suddenly vomited. Then after that, go blank. Then complain, headache. Then she says, don't know what's wrong with me. She went blank again. I was so traumatized by this. Don't know what happened. Faster call the ambulance. That's how it happened straight away. We went straight to the emergency department, and that's where they say she got precom aneurysm.
For me, I don't know what happened. I only know that I was sleeping. I woke up and found myself in ICU.
When she was diagnosed with brain aneurysm, leading her to have her stroke on her left hand, left side of the body. Also slight impairment of her eye, left eye also. Hillary had a few surgery, I think maybe about 5-6 surgery in her brain. One of them is a diverter to divert the blood flow away from brain. Another one is a shunt behind her back to divert away the cerebral. It cannot integrate itself out. So the diverter and the shunt will be with her forever.
Hillary has a small aneurysm, and this aneurysm actually is due to a focal dilatation or degeneration of the blood vessels. Most of these brain aneurysms actually do not rupture, but actually, unfortunately, in Hillary's case, it ruptured, and in that case, the situation can be critical.
This is the brain angiogram on the left side. What you see here is actually a fairly large aneurysm on the left side itself, and it's actually multilobulated. On the right side, what you see is actually the post-surgery CT angiogram, which actually showed that the aneurysm is fairly clipped with no more aneurysm sac seen, and all the blood vessels surrounding it are actually all preserved. So the patient is no longer in danger of an aneurysm re-rupture.
2 to 3% of the populations have brain aneurysms, but fortunately, most of the aneurysms do not rupture.
And if she falls, will be very, very serious. I cannot allow myself to let her go alone out, cannot. So each time she goes out, I have to tag along. Only lately, the therapist asked me to let go. Every time she went out on her own, she would text me her location. Mom, I'm at the train. Mom, I'm where station. I have to tag along for all her concert because concert too crowded. I scared either she bump into others or others bump into her. Yeah. And so that she will fall.
Because as a stroke patient, the difficulty is not hitting my head or anything. It's the difficulty of standing up from a lower position to a higher position.
Hi, Hillary and Mom, hello. How has it been? How many weeks has it been since discharge?
I didn't count. 1 over 1.
It has been about a month plus, right? How have you been?
In Hillary's case, the stroke affected the right side of her brain. This resulted in
paralysis and weakness on the left arm and left leg, as well as numbness as well. It also affected her ability to see things on her left visual field. So in many stroke patients, this is how they present. Weakness on one side of the body. They may have facial droop on one side of the face, as well as slurring of speech or difficulty swallowing.
Let's first assess your strength. So keep both arms up like that. I'm going to push up as much as you can. Okay.
By setting rehab goals for my patients, it really means setting realistic targets for my patients to achieve at the end of their rehab stay.
Going back to work full-time means 8 hours of focus, attention, meeting deadlines, submitting tasks without errors to your bosses, etc. It is important that I refer you next to my occupational therapist in Tan Tock Seng Rehab Clinic, and she runs a return to work clinic.
Okay, sounds okay. Better. So again, let me check again. If the fine is higher than this, which one will you charge the patient? Okay, getting there? Okay. So some individuals will actually be calling to change information.
And my role as an occupational therapist is to help patients to regain and restore their ability to perform the occupations that are meaningful to them. So these includes activities of daily living, such as the ability to dress themselves, shower themselves, take the public transportation, perform household maintenance activities, as well as like going back to work. I think Hilary has really come a very long way. I think she should be very proud of herself, and that's, I think, with also the support of her friends and her family. Press on to continue on with this journey is definitely not the end, and to continue to realize her dreams.
To all stroke survivors and their caregivers, my advice is that there is life after stroke. To prevent a stroke, it is important to lead a healthy lifestyle by exercising regularly and to keep the risk factors in check, which are high blood pressure, diabetes, and high cholesterol. It's important to also manage stress levels at home and at work, and to have adequate rest and sleep.
The risk factors for formation of a brain aneurysm and the growth of the aneurysm are related to hypertension and smoking history. So it is important to control the blood pressure well and also quit smoking.
Taking care of Hilary has to be, you have to give her tender loving care, because everything we have to do from scratch. Earlier stage we have to bathe her like baby like that lah.
I love you.